I'm Dr. Christopher Kramer from the University of Virginia, and with me today is Dr. Yuchi Han from the Beth Israel Deaconess Medical Center, and we will be talking about her manuscript, which involves imaging of patients with mitral valve prolapse with cardiovascular magnetic resonance. So Dr. Han, tell me, what gave you the idea to do this study?
Well, in our medical center, there's a very active EP group, and Dr. Peter Zimmerbaum has a number of patients who have mitral valve prolapse and ventricular tachycardia. And he and I worked as a fellow with him, and so we talked about this, and he was wondering if there's any additional information cardiac MRI can provide. So I then got together with Dr. Susan Young and Warren Manning. We discussed this, and we planned out the study looking at initially the MRI characterization of mitral valve prolapse, because that hasn't been done. And we also prospectively imaged a number of patients and found them to have papillary muscle delayed enhancement, and that seemed to be correlated with complex ventricular arrhythmia.
Did you find late gadolinium enhancement in other areas beyond the papillary muscles?
Not really. We also looked at perivalvular area. However, maybe because the valve, the mitral annulus actually enhances on the delayed enhancement, we were not able to really observe any additional enhancement in the myocardium.
Now, is this a standard late gadolinium enhancement sequence, or was there something special about the sequence you used?
We did the standard 2D delayed enhancement, and in addition to that, we performed a 3D navigator-gated delayed enhancement sequence developed by Dr. Dana Peters from our institution. The sequence involves navigator gating and takes about 3 to 4 minutes in a patient who is a good breather. And if the patient has difficulty in terms of respiratory tracking, it may take much longer. But what we found was in about half the patients, we were able to see delay enhancement in the traditional 2D delay enhancement sequences, but the 3D provided more detailed information, because the 3D spatial resolution is 1.3 times 1.3 times 5 millimeters, as compared to 2D, which is 2 millimeters times 2 times 8 millimeters.
Tell me about the association between late gadolinium enhancement in the papillary muscles and ventricular arrhythmias in your patients.
We prospectively studied 16 patients, and everybody who had who had complex ventricular arrhythmias which was found by Holter or event monitor, had delayed enhancement in the papillary muscles. And there were also 2 additional patients who had no known complex ventricular arrhythmias, but also had delayed enhancement. There were additional patients who had no complex ventricular arrhythmias, had no delayed enhancement.
And how are you planning on following up this study? What are next steps?
So the next step, we're actually enrolling a larger cohort with 60 patients, looking 30 surgical patients. We want to define the left ventricular outflow tract stack in terms of valve morphology assessment a little bit better, with surgery as the gold standard, looking at prolapse, to provide non-invasive assessment rather than TEE to assess all the scallops of the mitral valve. And in addition to that, everyone is getting the delayed enhancement, the 3D navigator-gated delayed enhancement sequence, and Holter monitoring, because we want to see whether or not in the cohort that we presented in the paper, the average mitral regurgitation was 3+. And we want to see whether or not in patients who have no mitral regurgitation or very mild mitral regurgitation, if there's any presence of delayed enhancement. because there is a small group of patients who had no significant mitral regurgitation, but also had increased risk of sudden cardiac death.
And I'm sure you'll be following these patients long term for ventricular arrhythmias and for sudden death.
Yes, we definitely hope so, and we're also hoping that we'll have enough preliminary data to open a much bigger study where we can truly assess the risk of ventricular arrhythmias and sudden cardiac death.
Thank you. We hope you found this quite interesting, this novel finding of late gadolinium enhancement as a marker of fibrosis in the papillary muscles in patients with mitral valve prolapse. This indeed may be a marker of adverse outcome in this patient population. Thank you for your attention.